Today I want to share on the pragmatic approach to facilitate worldwide access to COVID-19 vaccine. Let's look at the world today on COVID-19. There are altogether more than 270 million cases of COVID cases, and that bring about more than 4.5 million deaths in the world. In US case, the hospitalization rate is for people for adult population has increased recently from 2 hospitalization per 100,000 population to 10 people per 100,000 population. US has about 4 out of 10 people in the old age or health problem group who have a higher risk of developing serious illness. The general recovery rate is about 97 to 99%. Currently, 39.6, almost 40% of the world population has received at least one dose of vaccine, but only 1.6% of the low-income country has received vaccine. In terms of production and export of vaccine, you can see that in the pre-pandemic vaccine export market, the top vaccine producers are EU, India, China, and US. But China and US are mostly produced for their own local consumption. Other important players are like Indonesia, Korea, Japan, and Russia. And for EU, they are mainly exporting to high-income countries at higher price, and low-income countries only about 12%. India is the one that export the most of the vaccine to most of the developing countries under developer license. But under the current pandemic period, the vaccine producer had changed in terms of ranking. China has now become one of the major producers, donating and exporting 750 million doses to different regions of the world. Euro produced and donated about 300 millions. US had limited capacity and only exported 110 millions. India, because of the outbreak of virus, only produced local use. And same for Russia. The present inadequacy of the vaccine supply is due to a profit-driven motive. Many of these vaccine developers are basically business-minded, and so vaccines are arranged according to procurement commitment agreement process, and they are unwilling to waive the patent rights and encourage technology transfer to developing countries. UK Exact, which is licensed to produce in India. And the world leaders are disunited in the fight against the COVID-19. And because of vaccine nationalism, ideological differences, and lack of global cooperation on knowledge sharing, technology transfer, and vaccine safety issue, then we still have this problem. And there's unequal access to global vaccine will likely cause a more deadly virus mutation in the future. My proposed solution is that to make COVID-19 vaccine a global public good. In extraordinary time, there is a provision in the WHO's trade-related aspect of intellectual property right that can forbid the patenting of diagnostic vaccine products. And presently, only UK Exact produce the product at factor cost. But other Western countries are not willing to waive their patent right. But China is prepared to wave the baton, right? In May 2001, Xi Jinping said that China intend to make vaccine a global public good. China can meet the vaccine in the world, especially developing countries, because it has successfully controlled the spread of COVID-19. It has injected 1.4 billion locally and had the potential to export half of the 5 billion doses overseas. They have developed a pool of vaccine and have been authorized for use using different vaccine technologies such as inactivated virus, protein subunit, viral vector, and mRNA. And China has a great pool of hardworking population and large production capacity. For example, Sinopharm can produce 5 billion annual doses, while Sinovac can produce 2 billion doses. And Xi Jinping promised to supply 2 billion doses in 2001 to the world. But EU and US can continue to meet the needs of the world, especially in the developed world. World Health Organization should play a major role in the global vaccine program. They should coordinate the technology transfer, production, equitable distribution of a vaccine. So seek out China and other vaccine developer to expedite the production, technology transfer, and regional manufacturer and provide a fair compensation for these vaccine developer. And they should have discussion with China and other interested parties on the terms and conditions related to vaccine as a public good. And they should work out a fair and equitable, logistical, efficient distribution plan for vaccine. They should engage all stakeholders to ensure the safe and quality vaccine product. Can we bring a global COVID-19 under control? No, if we are disunited. And that will cause more financial and emotional stress. But we can move away from this uncaring, self-centered, and political conflict mode into a more altruistic and cooperative spirit for the common good of the global community. But there are other areas for future research as well, such as the safety and suitability of the various vaccines for different ethnic groups in the world. For in the case of AZEC, for example, Taiwan has recorded a very high death rate, 532 deaths for 6 million jabs compared to only 49 deaths for 28.5 million jabs in UK. And there are many countries in the world are underreported their vaccines, the side effect. Effectiveness of the existing vaccine against evolving variants, and also researchers should explore the alternative treatment medicine such as hydroxychloroquine and ivermectin. Thank you.